Welcome. In this session, we're going to speak about unintentional injuries. By the time you finish this session, you should be able to speak comfortably about the burden of unintentional injuries, how that burden varies by region, age, and sex, the costs and consequences of unintentional injuries, and selected measures that can be taken to reduce the burden of unintentional injuries. Let's begin with a few vignettes to help illustrate the issue of unintentional injuries. Jose is an 18-year-old man in Lima, Peru. He just got his driver's license. As Jose was going out driving one night, he was confused by the street signs in a place he had never been to before. He turned left into oncoming traffic and was badly injured in an accident. Road traffic injuries are a common cause of death, especially for young men in many countries. Mahmoud was a young boy in Bangladesh. One day, Mahmoud strayed from his older brother, who was watching him, while his mother was cooking. Mahmoud fell into a stream near his house and drowned, joining many other young people who drown in the world every year under similar circumstances. Paitun is an 80-year-old man in Bangkok, Thailand. He's very strong for his age, very independent, and likes to take walks alone in his neighborhood. Recently, however, he lost his balance while walking, fell hard on his face, and is now recovering from a broken nose and multiple bruises. Every year in every country, many older people suffer injuries from falls. Now, before we go any further, we need to clarify what we mean by unintentional injuries. And so let's look at two definitions. The first is the definition of injury. And here it's defined as the result of an act that damages, harms, or hurts, unintentional or intentional damage to the body resulting from acute exposure to thermal, mechanical, electrical, or chemical energy, or from the absence of such essentials as heat or oxygen. Now, an unintentional injury is defined as a subset of injuries for which there is no evidence of predetermined intent. Now let's begin to explore the burden of disease from unintentional injuries. But I want to note that for the purposes of this discussion, we're only going to explore a selection of such injuries. And these will include road injuries, poisonings, falls, fires, and drownings. Let's probe now the deaths related to unintentional injuries. And we're going to look first at deaths from unintentional injuries in 2010 compared to total deaths from group 1 and 2 causes for World Bank regions, low and middle income countries, high income countries, and globally. And I want to remind you that group 1 causes relate to communicable diseases, maternal, perinatal, neonatal, and nutritional conditions. Group 2 causes non-communicable diseases, and then we have the selection of unintentional injuries at which we're looking here. Here what we see is that when we're thinking about deaths, unintentional injuries as a percent of all deaths range across these groups of countries from 4% to about 11%. Deaths to group 1 causes range from 7 all the way up to 67%, of course, in sub-Saharan Africa. And the range of deaths to group 2 causes goes from about 25% in sub-Saharan Africa up to 87% for the high-income countries and 85% in Europe and Central Asia. Now let's take a similar view, but for DALYs. And here what we see, we're looking at DALYs from unintentional injuries, or attributable to unintentional injuries, 2010, again compared to total DALYs from group 1 and group 2 causes for the same groups of countries as before. And it doesn't look that different from the view that we had of deaths. Here what we see when thinking about DALYs is DALYs attributable to unintentional injuries ranges from 7% to 14%, and that compares with group 1 causes that range from 5% in the high-income countries all the way up to 69% in sub-Saharan Africa. and non-communicable causes, group 2 causes, that range from 24%, of course, in sub-Saharan Africa, all the way up to about 85% in the high-income countries. The next graphic looks at the leading causes of death and DALYs that are attributable to unintentional injuries in low and middle-income countries in 2010. And this is a ranking that shows you what of the deaths that occur from unintentional injuries, what share of them can be attributed to each of these 5 causes. And we'll see both when we think in deaths and in DALYs that road traffic accidents have a much larger impact than any of the other causes. And then we see that falls are second, and drownings, fires, and poisonings are third, fourth, and fifth. It's also important to break down the distribution of deaths from unintentional injuries for males and females because they're not equally important. So here what we see is the distribution of deaths from our selection of unintentional injuries for males and females in low and middle income countries only in 2010. Here we have males, here we have females, here we have the causes which we're examining. And here what we see is that the list really is quite different. The leading cause for males by far is road traffic accidents, followed by falls and then drownings. The leading cause for females is road traffic accidents, followed by fires, and then falls, and then drownings. And we see globally that for when we look at men and women both, we see it's road traffic accidents, then it's falls, then it's drownings, and then it's fires. Now, the next slide gives us yet another view, and this is the view of road traffic accidents by World Bank region, plus low and middle income countries and high income countries. And here what we're trying to do is get a sense of what is the percentage of total deaths in these countries that are represented by, attributable to road traffic accidents. And we see that it varies between 4%, the highest in the Middle East and North Africa region of the World Bank, to 2% in Europe and Central Asia. We also see that road traffic accidents contribute to a smaller share of total deaths in the high-income countries than they do in low and middle-income countries or globally. Now, in order to get a sense of what might be done to address these causes of death and causes of DALYs, we need, of course, to understand what some of the key risk factors are for them. If we're going to address the causes of these unintentional injuries, we need, of course, to understand the risk factors for them. So let's look at a graphic that looks at some of the key risk factors and determinants for the causes of unintentional injuries that we're discussing. For falls, we know young people may fall as a result of their normal physical activities, but we also know that lower socioeconomic status children are at greater risk of being injured in a fall than higher socioeconomic status children. We also know that as you age and your overall physical condition deteriorates, you become at greater risk for being injured in a fall. Burns are associated with low income, poor housing, living in a crowded area, living in rural areas, and young children may be burned because they lack an understanding of the risks of fire. Males are more susceptible to drowning than females are. Young children are more susceptible than older children, as everyone would surely know. In low-income countries, often, especially those where there's a lot of water, young children may be exposed to the risk of drowning solely by virtue of some of the daily activities in which they engage. In high-income countries, it's more likely that they'll be at risk because of recreational activities. And we also know that children are at greater risk when they come from poor and larger families, which may have something to do with the difficulty of just taking care of and watching all of your children. Young boys, especially under 5, are more susceptible to poisonings than others, but young girls 5 to 14 are also at important risk. We also know a risk of poisoning is when poisons are packaged in non-standard containers that children especially don't recognize may contain something harmful, and when children can in fact reach those containers. And we also know that lower income parents often lack some of the wherewithal needed to try to reduce the risk of exposure to poisonings of their children. For road traffic injuries, something with which most of us will have more experience, sadly, and a better understanding, one of the risks is the increasing use of motor vehicles in low and middle income countries, two-wheeled vehicles that are often quite unsafe on roads with many other kinds of larger vehicles, insufficient attention in many places to road planning, design, engineering, signage, or traffic management, often a lack of enforcement of speed limits, sometimes associated a lack of enforcement of drunk driving, and limited use of seat belts and motorcycle helmets as well. Clearly, given what we know about the share of total deaths caused by unintentional injuries and the DALYs attributed to them as well, it wouldn't be a surprise to understand that the costs associated with unintentional injuries worldwide are considerable. The economic burden due to such injury includes direct costs such as medical care, hospitalization, rehabilitation, and funeral fees, as well as indirect costs such as lost wages, sick leave from work, disability payments, insurance payouts, and costs associated with family care. These costs can be catastrophic for people within certain socioeconomic strata or those without sufficient access to health insurance. In this case, costs are frequently borne by government or private social services, or they're just immiserating. In all cases, however, it's important to understand the extent to which injuries represent a significant drain on both personal and societal resources. The World Health Organization estimated in 2006 that the direct cost due to road traffic injuries alone was about $500 billion annually, with the share borne by low and middle income countries between something like $65 billion to $100 billion. The World Health Organization also estimated that these costs are about 1 to 2% of gross national product of low and middle income countries. The consequences of unintentional injury are not just limited to financial costs. There's also significant social consequences for individuals and families that may be associated with such injury. Numerous studies have documented the long-term physical and psychosocial consequences of unintentional injuries. One might have persisting problems of pain, fatigue, memory, and psychosocial functioning, which could be common in victims of trauma related to these injuries. The psychosocial consequences for families of child injury victims especially may be very significant, with difficulty related to finances, changes in work related to the need to care for injured children, and altered family dynamics. So let's end by talking about what can be done to address some of these unintentional injuries, keeping in mind, of course, both how important they are and the risk factors that we've discussed for them. For road traffic injuries, it's clearly important to engage in more careful licensing of drivers, the possibility of graduating licensing, so you only get to drive under certain circumstances as you're young until you get more experience, better signage, better engineering, safer cars, motorcycle and bicycle helmets, as the Vietnamese and the people in Taiwan learned very effectively, and road calming measures, such as traffic circles and speed bumps. It's also important to enforce laws and speed laws, as well as laws against drunk driving. For poisoning, it's important to ensure that communities understand the risks of poisoning, that they understand how they might better package and label poisons, how they might better store them in safe places out of the reach of children. South Africa had some important successes in reducing deaths from childhood poisoning by actually giving away to families child-proof containers in which they could store such poisons. In high-income countries, people often work with older people to help them enhance their balance and their ability to walk safely as they age and weaken. But in low and middle income countries, it may be that among the better things they can do or most efficient things they can do for helping to reduce falls in older people will be to promote community-based education about the risks of falling and eliminate hazards that might be posed to older people. For younger people, in countries, for example, where they have play equipment at schools and playgrounds, it's important to try to build safety into the design of such equipment. For drowning, it will also be important to promote community education, though it's interesting that in Bangladesh there was an experiment where they either had door barriers or little playpens for children, and they saw a very substantial uptake of the playpens but not the door barriers. But we don't have very good evidence yet of the extent to which they were associated with keeping children away from water, which is everywhere in Bangladesh, and reducing the number of children who drown. There's very little data on measures that can be taken in low and middle income countries to reduce the risks of fire and burning, but here too it looks like good community education will be a starting point. So hopefully you now have a better sense than you did earlier of the importance to deaths and the importance to the burden of disease of the unintentional injuries that we've been discussing. You also understand more about some of the risk factors for these and hopefully some of the measures, including community-based measures, that might be taken to address them in effective and efficient ways. In the next session, we're going to talk about how science and technology can be harnessed to meet the unfinished agenda of health in low and middle income countries.